So today we are going to speak about and learn about cementum. Our teeth are shiny, beautiful structures. So when you smile, the first thing that anyone notices is your teeth. But these shiny structures are not so simple. It's a complete and a very complicated framework for which many cells and tissues are constantly and tirelessly working to keep that tooth healthy, vital and functioning. So let us come back to the structure of the tooth. The crown is that part of the tooth that is visible in the oral cavity, whereas the root is that part of the tooth which is hidden and helps attach this tooth to the underlying bone. It is this root that is very special because this root is acting as a foundation trying to hold the tooth firmly in its socket. And this root is covered by a very special tissue which is called as cementum. Just like enamel covers the crown of a tooth and acts as a protective covering for the crown, preventing the tooth from breaking or helping you to chew onto even hard food. Similarly, cementum acts as a protective layer of the root, protecting the root and helping attach it to the adjacent bone. So the primary function of cementum is to attach the root to the adjacent bone by means of collagen fibers. Cementum you can simulate with a building. So like a building has a foundation which helps attach the house firmly to the ground, similarly, cementum acts as an attaching medium which helps firmly bind a tooth to the bone. So in this chapter, we are going to read about the cementum, its structures, its properties, its features, how you can differentiate cementum from other tissues, and what are its form and functions. So to introduce cementum to you, cementum is a hard tissue. That means it is mineralized, but it is avascular. Avascular meaning it does not have any vessels. So there is no blood supply to cementum. Dentine, on the other hand, is a viable tissue. So dentine is more sensitive. Cementum relatively is less sensitive but is avascular. It is quite similar to bone. So if you look at the appearance and the chemical composition of cementum, it is quite similar to that of bone, but cementum is avascular, whereas bone is vascular. The term cementum has been derived from the Latin word cementum, which means quarry stone or rubble. This quarry stone or rubble has a slightly granular texture, and cementum also has a similar granular texture when you compare it with enamel or dentine. That is why cementum is called as cementum, which has been derived from the Latin word cementum, meaning quarry stone. Cementum begins at the cemento-enamel junction. So, cemento-enamel junction is located at the cervical margin of the tooth. Remember the tooth? The tooth, we could divide it into the crown and the root. The crown ended at the cervical line, and from the cervical line, the root began. So, cementum covers that part of the root which begins beyond the cervical line. Remember, the cervical line is the divisional part of a tooth which divides a tooth into crown and root. So, the cementum also extends from the cervical line till the apex. So, the entire root is covered by cementum. This cementum acts as a medium to help attach the periodontal ligament fibers to the root. And that is why it will help the tooth to be attached tightly to the bone.